Good afternoon, everyone. Thank you for joining us. I will start with the usual update on the COVID-19 statistics. I can report that an additional 12 positive cases were confirmed yesterday, which takes the total number in Scotland now to 18,182. A total of 865 patients are currently in hospital with the virus, either confirmed or suspected. That is 2 fewer than yesterday, and it includes a reduction of 3 in the number of confirmed cases. A total of 21 people last night were in intensive care with confirmed or suspected COVID-19. That's an increase of 6 since yesterday, but I should point out that the increase is all in suspected cases. And while, of course, our thoughts are with anyone in ICU for any reason, I think it does help perhaps to put today's number of 21 in ICU with confirmed or suspected COVID in context. On the 12th of April, there were 221 patients in ICU confirmed or suspected as having the virus. And as I'll come on to touch on again later on, that demonstrates the scale of the progress that we have collectively made in these last few weeks. Since the 5th of March, a total of 3,995 patients who had tested positive and needed hospital treatment have now been discharged from hospital. However, in the last 24 hours, 4 deaths were sadly registered of patients confirmed through a test as having the virus. That takes the total number of deaths in Scotland under that measurement of people confirmed by a test as having COVID to 2,476. Tomorrow, of course, we'll see the weekly publication from National Records of Scotland, which will give us the total number of deaths of those confirmed through a test and also those who were suspected of having had COVID-19. Now, today's statistics again show, and they show very starkly, the human cost of this virus, and my condolences go again to all those who have suffered bereavement. However, the statistics also underline the very significant progress that we've made in suppressing it, and that is really the point I want to focus on today. It is now 3 months to the very day, actually, since Scotland went into lockdown. Although I'm sure for all of us it seems an awful lot longer than that, it's worth remembering that back then we did predict that many of these measures would last a minimum of 12 weeks, and so it has turned out to be. There's no doubt that this has been one of the most challenging periods that our country has ever faced in the lifetimes of the vast majority of us. And of course, we've got to remember, and we see this in other parts of the world, it's not over yet. This virus continues to pose a major threat, and it is likely that it will do so for some time yet to come. And so it's fair to say that we still have a lot more work to do. But it's also important to remind ourselves of the progress that we've made, and to do that, to remember the situation we were in 3 months ago. Back then, COVID-19 was out of control. It was spreading exponentially. There was a very real prospect that our health service would be overwhelmed, even with the extra capacity that we had created. And back then, that was a daily worry for me as First Minister, for the Chief Medical Officer and the Health Secretary. And back then, none of us knew for certain how the country would cope. Today, we are in a very different position, as the numbers I've just reported demonstrate. Hospital admissions, which at one point were totalling 200 a day, are currently in single figures every day. As I've already mentioned, the number of people in intensive care has fallen by more than 90%. And while it is absolutely the case that one person dying from this virus is one too many, we've also seen a very significant and sustained decline in the number of deaths. And though demand was high at points and the pressure on NHS and social care staff extreme and remains extreme, at no point during this did our NHS come close to being overwhelmed. All of that progress is, of course, a direct consequence of your efforts and your sacrifices. Over these past 3 months, we have all contended with and coped with this virus in different ways, both individually and collectively. Our health and social care workers have had to respond to an unprecedented threat, and they have done so absolutely magnificently. Our businesses have answered the call. We now have, for example, whisky producers making hand sanitizer and clothing firms producing PPE. And all across the country, people have adapted to new circumstances, whether that's working from home or becoming a key worker. We have, in the most trying of circumstances, seen the very best of Scotland as our communities have rallied together in support of those in need, to check in on neighbours, to help people with shopping, or simply to offer a friendly face. For shielded people, the last 3 months have been especially difficult, not being able to go out and in some cases not being able to see anybody at all. And the images we've seen over the weekend of some grandparents now being reunited with grandchildren and shielded people finally being able to meet others outside show us just how hard things have been. And of course, perhaps most importantly of all for us to remember, more than 4,000 families across our country have lost a loved one to this virus. And around half of those lost someone who lived in a care home. That's something which I know I never lose sight of, and I know the sorrow of that will live with me forever. But I also know that is as nothing compared to the pain of bereaved families. So as we go through the recovery process, it's really important to remember those for whom this experience will never be completely left behind. Nor should we forget the enormous sacrifices made to get us here. So while we still have a long way to go, and I must keep stressing that, I want to take the opportunity today at this 3 months milestone to thank everyone who has played their part and stuck by the rules. In doing so, all of you have helped to protect our NHS as we set out to do, and you have undoubtedly saved a considerable number of lives. Of course, you've also made it possible for us now to gradually ease our way out of these restrictions. That's why last week I was able to announce our move to the next phase in our exit from lockdown, and it's why tomorrow I'll be able to provide some further detail on the timing of some of the specific steps in that journey. And I'll be able to do so tomorrow ahead of when I thought just a matter of days ago that might be possible. Later today, the Health Secretary will also update the Scottish Parliament on the remobilisation of our NHS and specifically on how staff and patients will be protected as we resume services that had been paused. And the Deputy First Minister will deliver a significant statement this afternoon on the reopening of schools and support to help young people catch up on missed learning. 4 weeks on from the report of the Education Recovery Group, when things looked bleaker than they do today, he will set out where we are now. And crucially, he will outline where we aim to be by August when the new term begins. And on that issue, I also want to take the opportunity today to say a few brief words to pupils who are about to leave school as the summer holidays begin. I know that some of you now will be finishing up, and I am so sorry that you're not able to celebrate this milestone in your lives with your classmates and with your teachers in the normal way. I know that is a bitter disappointment. This special moment in your lives, in the life of any young person, is not one anybody would have wanted to be marred in this way. And I understand that given these circumstances, you will be feeling even more apprehensive or unsure about what comes next. That's why we're providing a range of different support options to help you through this transition. For example, through developing the young workforce, our employability programme, we're offering school leavers the chance to take part in an online skills academy. And if you're interested in that, you can find out more detail and indeed detail of all the support available at the website www.dyw.scot. So please take a look. There's some really valuable help there if you need it. But also know this, and this is the personal message I want to convey to you. However difficult this experience has been, and it undoubtedly has been, the way you have coped with it has shown a resilience that should make you very proud of yourselves as you embark on this next phase of your lives. So I want to take the opportunity today to thank all of you and to wish all of you every success. Now, as I indicated earlier, as well as today's statement on schools and the NHS, I will provide a general update tomorrow on Scotland's route map out of lockdown. And as part of that, I'll set out some indicative dates for when some measures and some phases, all being well, will come into effect. I said from the very start that if we saw maintained good progress, we could move through phases perhaps more quickly or bring certain measures forward. And in some instances, that's what we hope now to be able to do. But I want to stress that we are still taking and will continue to take a cautious approach. Our aim remains maximum suppression of this virus, because that is what will give us the firmest foundation to face whatever comes ahead, to deal with outbreaks such as those we're seeing in other countries right now through targeted measures, and also equip us as best we can possibly equip ourselves to deal with any possible resurgence of the virus as we enter the winter months. That's why on all of these decisions we will continue to proceed very carefully. It's why, for example, I've commissioned additional work from our scientific advisory group. One key issue we have asked about is the issue of physical distancing. The Scottish Government is clear that the advice and evidence we have right now supports physical distancing at 2 metres in order to reduce the risk of virus transmission. But we have asked in what settings, what circumstances, and with what additional mitigations it might be possible to accept the risk of people not keeping to a 2 metre distance. That advice will be available by the 2nd of July, ahead of our decisions on moving from phase 2 to phase 3. Until then, the position here in Scotland remains the same. We are advising people to maintain 2 metres physical distancing. So any changes announced today for other parts of the UK, while we will look at the evidence underpinning those very carefully, will not apply here at this particular stage. I will update next week on the outcome of the exercise we've asked the advisory group to do. Of course, the more we can continue to suppress the virus now, the more likely it is that we will be able to consider some changes to that rule. So to close today, let me reiterate the critical public health guidance which everyone needs to follow. You're now, of course, able to meet up with up to 2 other households, but these meetings must be outdoors. You should only go indoors to use a toilet or to get through to a garden, and you should remember to clean any surfaces you touch as you do so. I know that as we start to see the virus receding and as we ease some restrictions, it is easy for all of us to become complacent, but we must guard against that. The virus hasn't gone away, and as we gradually remove restrictions that have kept it under control, we face a risk that it will start to circulate more rapidly again. So we must proceed with purpose, but also with caution, and we all need to continue to play our part in suppressing it. The public health campaign we launched last Friday, Facts, summarises the key points all of us need to remember every single day. Face coverings in enclosed spaces, avoid crowded places, clean your hands and hard surfaces regularly, 2 metres distancing, and self-isolate and book a test if you have symptoms. It's by remembering these 5 basic but crucial measures that all of us can stay safe, protect others and save lives. So my thanks go to all of you for all of your sacrifices over these last 3 months and for continuing to show the patience and forbearance that will see us make more progress against this virus. Thank you very much for listening today. I'm joined, as usual, or as I often am, by the Chief Medical Officer, Health Secretary, as I indicated, is in Parliament. But we will move now straight to questions today, and the Chief Medical Officer and I will answer them. So my first question today comes from Lindsay Bewes from BBC Scotland.
Good afternoon, thank you. First Minister, the UK Government is expected to move to 1 metre social distancing today, and given that's based on scientific advice, is it just inevitable that Scotland will now also move 1 metre? And do you accept that waiting until the 2nd of July creates difficulties for planning for schools and businesses? And can you give any indication of the kind of measures that would need to be in place in schools and in businesses to open under reduced social distancing rules?
I think I covered all of this pretty comprehensively in my opening remarks. I've not seen the scientific advice that the UK Government decision will be based on. I don't know whether that will be published later on. We will be very interested in looking at it if it is published, but I have asked for advice from our own scientific advisory group looking at the circumstances in which we may be able to accept the greater risk. And there is a greater risk of transmission if we move from 2 metres to 1 metre, but in what settings, in what circumstances, and with what additional mitigations that would be acceptable is what I've asked the advisory group to do. That advice will be with us by the 2nd of July at the latest. That is next week, just over a week away, and I think it is worth waiting that length of time to make sure that we satisfy ourselves on the basis of any decision that we make. Because as we come out of lockdown on all of these elements, we all take on greater risk. The virus has been suppressed to the extent it has because we've all lived under extreme lockdown. So the risk increases as we come out of that and as we change some of the rules. That's inevitable, the risk increases, but the decisions about how we best manage and mitigate it remain important. But I am under no illusions at all about the economic benefits to many if there is greater flexibility around that, which is why I have asked for this work to be done. On schools, I think I'll leave the Deputy First Minister to set out the position on schools. I have said repeatedly in the last couple of weeks that we want to get young people back into schools full-time on a normal basis as quickly as possible. And the Deputy First Minister will say more about that this afternoon. But as I said yesterday, saying that is one thing. Creating the conditions to achieve that is where the really hard work has to be done. And partly that is about continuing to suppress the virus, but also it is about assessing the different bits of scientific evidence. What kind of mitigations from hygiene to possibly testing do we need to have in schools if we are not going to have a 2-metre physical distancing? So some of that inevitably takes time and a lot of hard work to get through. But it has to be done because all of us want to see young people back in full-time education as quickly as possible. But my last point would be this. It must be safe. We're seeing in other countries some of the growth in cases in America. I'm reading a lot at the moment about how there is some increases in incidence amongst younger people. We have seen some flare-ups in some schools in England since schools in a very limited way reopened. So we must take care, but there is nobody, well, I'm sure apart from all of the parents across the country, let me concede that point, but take it as read that I want to see young people back in full-time education as quickly as it is safe and practical to do so. Ross Govans from STV.
Afternoon, First Minister. I appreciate you have mentioned the advisory group and waiting for that, but can you give us an indication of what level the R rate would have to be in Scotland before you would feel comfortable with cutting social distancing from 2 metre to 1 metre? And isn't this simply a case of different interpretation of essentially the same advice?
The advice may end up being the same, but I think having asked the advisory group for that advice, I think it would be wrong for me to go too far in preempting what that advice may be. And, you know, what I'm saying now is not seeking to preempt the advisory group, but, you know, saying a couple of things just from my own knowledge. I think it is, although if the advisory group decide otherwise, I will no doubt have to say I'm wrong about this, but I would caution against seeing it as a level that the R number has to get to. What we are, and you'll probably hear us talk a bit more about this, the R number over the weeks to come, the R number has been really important, but as we're seeing in Germany right now, the lower the number of cases become, then the smaller the changes to actually have quite a big impact on the R number. It's just the way that particular measurement works. So actually the R number, while I'm not saying it is unimportant, we've got to be more cautious about the interpretations we put on changes to that. So the R number in Germany right now, I think, has gone back to almost 3. But that is driven very much by a localised outbreak. The overall incidence of cases remains quite low. So it's much more about numbers of cases and getting daily new cases and the overall infectiousness in the country to as low a level as possible. And it's also about what mitigations would be put in place. It is not necessarily the case that 2 metres, 1 metre is a, pardon the pun, a one-size-fits-all. There will be some circumstances in which the advice may be that 2 metres should be continued. There are others where, with other mitigations, it may be able to be reduced. But as I've said repeatedly, and you'll have heard me say repeatedly, it's really important not to see this as a binary, simple issue. There is no doubt that if you go from 2 metres to 1 metre, you increase the risk of transmission from something, I think, between 2 and 10 times. So it's how you mitigate that increased risk in other ways, recognising, as I think all of us do, that in some settings 2 metres is practically very difficult to achieve, particularly for some businesses and their ability to be viable. So these are all things we are going to look at very carefully to try to get to the right balanced outcome. Gregor, do you want to say any more about maybe our number and the the decisions are 2 metres as well.
I mean, there's no doubt this is complex, isn't it? And I would agree with the assertion that there are numbers less relevant in these circumstances at all. But looking at the broader elements of risk that are associated with transmission becomes really important. So what are the characteristics that actually drive transmission? Well, some of that is about how likely it is that two people or one of those two people may have infection. So actually what your infectious pool is in the background here and how likely that is that one person can then transmit to another. We then look at other things, characteristics of both people and their ability or the likelihood that they'll spread themselves, but also the environment that they're in as well. And we're learning more and more about the types of environment that perhaps enable spread much more easily. And those can be from simple things like the loudness of an environment, the way people project their voices, the likelihood that they're creating droplet spread, whereby that virus can kind of hitch a ride to go and transmit to someone else. The kind of the temperature, the humidity of the environment. There are all sorts of different characteristics of the environment that begin to influence that likelihood of spread as well. And that's where the judgment around about whether a 2 metres, a 1 metre, or indeed greater is and the mitigations that are likely to kind of reduce the risk of spread in that type of scenario start to come into play. That's the question, the basis of the questions that we've asked the advisory group, and we expect to hear from them.
Thanks. Peter McMahon from ITV Border.
Thank you, First Minister. First Minister, in your opening remarks, you mentioned that you had huge sympathy for people who lost someone in a care home. ITV Border has spoken to David Dougal, who lost his wife of 55 years with coronavirus at Salt Greens care home in Eyemouth. That's the 8th death in a care home that only had 34 residents. Now, Mr. Dougal has told us that while he doesn't, and I quote him, want scalps, he does want to know what happened. Now, the latest figures for the south of Scotland show that despite a promise 5 weeks ago, still not even half residents and staff have been tested. So does Mr. Dougal, first of all, have a right to know what happened? And secondly, how can we move out of lockdown if you're not delivering on that promise to test residents and care home staff?
Well, we will be delivering on that promise that is ongoing, and just to remind people that the latest figures on progress there will be published tomorrow, so we will see the progress that has been made since the last figures. I assume, maybe wrongly, the ones you're quoting were from last Wednesday. And that will be an ongoing commitment. So care home staff will be tested regularly as we come out of lockdown and indeed live with this virus potentially for a significant time to come. The Health Secretary in Parliament shortly will also set out a bit more detail of how we're going to expand testing into NHS staff to help with the remobilisation of the National Health Service. Mr Dougal does have a right to expect answers, and I would want to start by expressing my heartfelt condolences. I can only imagine, because I didn't go through it myself, how harrowing and heartbreaking it must be to have lost a loved one to this virus, whatever the circumstances and wherever the location of that. But given the particular vulnerabilities we know of older people in care homes, I think that sense of anguish and heartbreak will be even greater. And I don't expect it to be any comfort to somebody like Mr Dougal who has been bereaved by this, but I do want him and others in his position to know just how deeply I feel that sense of sorrow for what they have gone through, and how determined I will be in the fullness of time, when we have the ability to properly look back, to learn the lessons, to give the answers where that is possible to people who have been bereaved, and to make sure that there is a proper examination of what was done, why it was done, and whether mistakes were made. You've heard me say many times before that we operated with the best of intentions, doing the best things on the basis of the evidence we had. Some of the decisions that are questioned now, and it is entirely legitimate, are questioned in the light of knowledge and understanding of the virus that we have now that we didn't have then. But there will also be things. I think it is important that people like me are not defensive about this. We have been dealing with a unique and unprecedented situation, with a virus that we've all been grappling and are still grappling to properly understand. Mistakes will have been made, and we have to, at a point where that will be determined and judgments will be made on that, we have to be prepared to acknowledge that if it is the case and learn from that. And I want to say to Mr Dugald or to anybody else in this position that I have an absolute determination. I want to know what we did right and what we could have done better in order that we learn those lessons. And I know that everybody who has suffered the consequences of this virus will want to know that too. Neil Pooran from PA.
Thanks, First Minister. Professor Devi Sridhar of Edinburgh University says it might be possible to eliminate community transmission of coronavirus in the next couple of months. And I was wondering if you thought that could be possible to achieve in Scotland if we get everything right, of course. And if I could also perhaps ask the CMO, is there a point at which our current modelling suggests that we will reach 0 cases of coronavirus, given that the R number has been below 1 for some time now?
I'll hand over to Gregor in a second. Professor Sridhar, of course, is a member of the Scottish Government's the CMO Scientific Advisory Group, so advises us directly through that forum. We've got to, and Gregor may want to say more about this from his specialist perspective, but we've got to understand the difference between elimination and eradication. Eradication is when it effectively goes away forever and probably would depend on an effective vaccine. Elimination is about where domestically we get it to the lowest possible level, but that doesn't mean we don't still have the risk of outbreaks and imported cases. So the challenge then, well, the opportunity, if you get it to that level of elimination, is that you can deal with outbreaks and imported cases on a much more targeted basis, rather than facing the prospect of general blanket lockdowns again. The challenge, of course, is to make sure we have the ability to track and trace, which is what Test and Protect is all about. And the other thing that we have to consider, and Scotland does not have total freedom of decision making here, is about how we deal with the possibility of imported cases, both from internationally and perhaps from elsewhere in the UK. And of course, we are looking at all of these issues just now to make sure that we are as well prepared and as well equipped if we get it to that level of elimination, which on the figures we're looking at right now, we are not far away from, but we have to keep at it. But then it's about how we keep it at that level and deal with any flare-ups and outbreaks as they appear. Gregor.
It's a really good question, and I think if we continue along the trajectory that we're following just now, and that we continue to consolidate around the change of the measures so that people continue to observe not only those but the simple measures such as making sure that they are wearing face coverings in the scenarios we've described, that we're making sure that they're keeping adequate distancing from each other, that they're cleaning their hands and surfaces regularly, all those different elements that we can take, we can continue to reduce the number of cases across Scotland over the next couple of months, and particularly over the summer months, because we're still not sure of the influence of the kind of seasonal activity of this virus, but we should try to take advantage as much as we can of that, any advantage that confers us as possible. Can we completely eliminate the virus? I think that becomes more challenging in this respect, but we can certainly control and suppress this virus at very, very low levels, so that our main consideration is in dealing with any outbreaks as they begin to become apparent. And our biggest weapon in terms of being able to do that is undoubtedly the test and the protect procedures and processes that have been put in place. Making sure that people recognise the first signs of any symptoms that they develop, the right place to contact to make sure that they are then being tested and isolate themselves and any other household members, to make sure that we're breaking these chains of transmission as early as possible. And if we can do that, then I do think that over the next couple of months we can keep these levels at a very, very low and suppressed level, so that elimination begins to be within reach of us. Over the longer term, it then becomes much, much more important as to how we approach the issue of importation of new infections from other areas. Already you'll see some of the measures that have been put in place to try to do that, but over time the importation of cases may become even more significant and important in terms of our overall strategy, and we need to keep alive to that as well.
Fraser Knight from Global.
First Minister, this morning we've heard from shopping centre operator Interim saying that they've brought administrators on board as they hold crunch talks with lenders. And that comes with a warning that they may have to close some of their sites, obviously putting thousands of jobs at risk, including some at Braehead, just outside Glasgow. Now, I understand you'll be watching the situation quite closely, but I was just wondering, are you concerned about this? And would the Scottish Government, if it came to it, be willing to step in to save them, as they say that much of this is down to the loss of money from the coronavirus pandemic?
Well, of course I'm concerned about that, and I'm concerned about all and every business that is suffering real hardship and existential threat because of the impact of what we've had to do to deal with the virus. And we will, have discussions through our enterprise agencies with any employer and with any business to see what support the Scottish Government can offer. That's not, I don't want that comment to be taken particularly in relation to Into, because these discussions have to be had on a proper basis. But we have, I think, demonstrated, not just through this crisis, but long before that the Scottish Government, where an intervention from us can make a difference and where we can satisfy state aid and value for taxpayers' money considerations, then we are always willing to consider that. Obviously, the most important thing we can do for retail and for shopping centres is to get them open and trading again as quickly as possible, and that's what we are very focused on. Non-essential, for want of a better expression, retail will open in Scotland again on Monday. That does not at this stage include indoor shopping centres, because there are other considerations around numbers of people in enclosed spaces for longer periods of time, use of public toilets, all of these things that we have to think through a bit more, but we want to give the go-ahead to shopping centres as quickly as possible. And, as I said, I will lay out tomorrow, looking ahead, some more indicative dates of when we think different parts of the economy and society can start to reopen. All of it contingent, of course, on us continuing to make the right progress, and in some cases contingent on some of the advice that we will get over the next few days from the advisory group, but trying to give that greater sense of clarity about when different parts of the economy and society can plan for that reopening. So getting, and this doesn't just apply to retail, it applies more generally, getting the economy up and running, open and trading and making money again is the most important thing we can do, albeit there will continue to be a need for targeted support as we go through the recovery process. Tom Martin from the Daily Express.
Hi, good afternoon. Thank you, First Minister. Just going back to the 2 metre rule, you've previously talked about the likes of the use of face masks as a mitigation measure. I just wondered if you could clarify what other things could be looked at. Is it, the likes of improving ventilation? Is it the likes of how people are seated in certain settings, whether it's face-to-face or moving them side to side, for example, in a restaurant or a bar, just to get some idea of what might be helpful?
So basically, you've kind of answered the question in your question. And again, I don't want to preempt the advice that is yet to come to me. But so what I'm going to give you here are some illustrative examples, which are pretty much the illustrative examples you have already given. So it could be face coverings. It could be having more perspex screens in certain settings. It could be changing seating patterns in indoor circumstances, and basically what it might mean, it will be different in one setting to another setting. I spoke yesterday, and I would suspect this may be something all governments across the UK are looking at as well. That in hospitality, it could involve taking names and addresses of people who go indoors, in order that should there be an outbreak of the virus, or if somebody proves positive, there is an ability to quickly trace the others that have been there at the same time. So all of these kind of things are potential mitigations if you allow for flexibility around 2 metres in circumstances where, for practical or economic reasons, it is difficult always to maintain it. But again, as I think I am probably illustrating in this answer, these are things that have to be thought through quite carefully, and we then have to make sure we have the right guidance for commercial operators to know what they need to do. And that's the work that the advisory group is doing. As I say, I'm expecting that the UK government will make an announcement on this afternoon. It's for them to make that announcement, not for me. But I've not seen the evidence that underpins that announcement, nor would I have expected to necessarily. But if it is published or we can access it, of course, I'm sure our advisory group will want to look at that and factor that into the work that they are doing. Christine Lavelle from The Sun.
Thank you, First Minister. You mentioned yesterday that you're looking at introducing testing in schools. I just wondered if you're able to expand or give any more details on what that might entail. I know Professor Streeter has suggested testing teachers and older pupils twice a week might be a way of returning to near normal education in the future. Is that the type of thing that you're looking at doing?
I'm not able to give any more details of that today. That is one of the things that we will require to work through with our scientific advisors so that we know the right package of measures that will be required to, as soon as possible, get children back to school full time. But I think it's better that we take that advice, we do that work, and then we set that out clearly. John Swinney will set out the general direction of travel this afternoon, but he will be very candid that there are aspects that, in terms of what we don't yet know for sure about what the virus is going to do and some of these other details that we need to continue to take scientific advice on in the weeks ahead. Conor Matchett from The Scotsman.
Thank you, First Minister. Yesterday, concerns were raised by bus drivers in Edinburgh who were told not to challenge people who did not wear face coverings, that the rule was essentially unenforceable. Will we see policemen patrolling buses? And if not, how does the Scottish Government expect that rule and that law to be enforced across the country?
Well, on public transport right now, it is mandatory. That means it can be enforced. There is the ability for the police to impose fixed penalty notices for people who don't wear a face covering. We don't, and I don't think it would be reasonable to expect those who work on public transport to be the enforcers of this, and which is why we said that is not our expectation. But equally, I would hope that the police don't have to impose fixed penalty notices or get involved in an enforcement capacity, because I really want people to do it for their own protection and for protection of people that are around them. This is one way. It's not, I mean, let's be very clear again, face coverings are not a substitute, absolutely not a substitute for physical distancing, hand hygiene, covering your nose when you sneeze, all of that really basic stuff that becomes more important as we're all out and about more. But we know that face coverings can confer an additional protection. And I've said this, you'll have heard me say this many times before. If you wear a face covering, if you have the virus and you don't know it because you're not having symptoms, but if you've got a face covering on, then you are less likely to transmit the virus to somebody else. You're not guaranteed not to do it, but you are less likely to do it. And conversely, if somebody that is sitting across from you in a bus has the virus and maybe doesn't know it, if they're wearing a face covering, they're less likely to transmit that virus to you. So it's one of these things where actually we're all being asked to do something, not for our own protection, but for the protection of others. And that's why protect others is one of the key aspects of what we're asking people to do right now. And if we act to protect others, then other people acting in the same way protects us. So it's one of these collective things that we should all do because it's the right thing to do, and it adds to that success that we are having and hopefully will continue to have in driving levels of this infection down. So I would appeal to people, obey, and in this case on public transport it is the law. We are still considering the position with retail, but don't, if people voluntarily in retail now do the right thing and wear face coverings, then, frankly, it becomes less of an issue about whether it's mandatory or not. We should all be doing this for the protection of others. And I think that's a pretty good principle for us all to proceed on over these next few weeks. Simon Johnson from The Telegraph.
Hi, First Minister. I wanted to ask you about a survey that the Scottish Tourism Alliance have published this morning of their members. They've said that basically a third of hotels are planning not to reopen on July the 15th because of the 2-metre rule, making it basically unprofitable for them to do so. 85% of hotels and restaurants will stop trading within 2 months if the 2-metre rule is kept, according to the survey. But can I get your thoughts on that and the suggestion from some quarters of the business community that your government maybe isn't acting as urgently as the situation demands? A quick question also for the Chief Medical Officer, because it's been reported this morning that a care home worker on Sky has recovered from coronavirus, then got it again. And I just wanted to get your thoughts on that, please.
I'll hand over to Gregor in a minute on the situation with the worker in Skye, which I know Gregor is aware of. On the 2 metre rule, look, I know there are frustrations about this, and I know there are differences of opinion about 2 metres, 1 metre. The one thing two things I would ask people to accept. One is it's not binary and straightforward, and anybody who suggests it is whatever the frustrations that lie behind it is doing a disservice to the argument. That's not a comment, incidentally, to the Tourist Alliance, who I know understand this well. But the second thing I would ask people to accept is that if it was simple and there was no risk in moving away from the 2 metres, then why on earth would I not just be saying, yeah, let's do it? I have no vested interest in 2 metres over 1 metre or 2 metres over 4 metres. I just want to do the best thing to reduce, as far as practicable, the risks of transmission of this virus, because we've seen, all of us, I know as it recedes, and this is not a bad thing because none of us want to live with the unpleasantness of the last few months any longer than we have to, but as the virus recedes, I know memories maybe get a little bit hazy on just how terrible the last few months have been in terms of the human toll of this. I want to minimise the risks of us going back there. And that's my only motivation. In terms of the urgency of this, I asked for further scientific advice last week. I will get it at the latest sometime next week, and then we will set that out. And we will, if that involves things we can do to change the 2 metres, I candidly hope it will, but I can't preempt what the advice will be. Then we will set that out in good time, backed by guidance for hotels and the tourist industry reopening on the scheduled timeframe of the 15th of July. I know how tough this is for everybody, but I know how tough this is for people who are watching their businesses get into real trouble. And I don't want that difficulty to last any longer, but I equally don't want us to act in a way that puts our progress against this virus at risk. Because if that happens, then we will be back into a situation where hotels and restaurants and bars are being told they have to close again, and that would be catastrophic for them. So I want to get the economy opened. I want to get it opened as quickly as possible, but more than anything, I want to get it open sustainably so that we don't have to go backwards. And that's what I'm going to strive to do at every step of the way, and do it as quickly as I possibly can. Vivian Aitken from The Record. Oh, sorry, Gregor, my apologies.
Yeah. Rather than comment on any of the individual cases, because I think it would be completely inappropriate for me to comment on any individual, probably what I'll do is confine myself to the global evidence that there is on what we as supposed reinfection. And when these cases of supposed reinfection have been examined in detail, one of the things that becomes very apparent in them is that it doesn't tend to be reinfection that has occurred, that it is actually it's a manifestation of the testing challenges that sit round about that. And to understand why that can happen, we need to understand the basis of the test that we employ to try to diagnose COVID-19. Now, one of the characteristics of this test is it works by trying to identify the viral RNA that the virus sheds when people become infected. And there are quite often what we see is that the PCR test, the way that they're employed, can pick up viral fragments rather than viable virus itself. So there's very plausible scenarios that can take place whereby a person will initially test positive that they're infected, they then might experience another test. That test may be negative, and it may be negative because of some of the sensitivity issues that we know are related to this test. The test's a very good test in laboratory conditions, but sometimes sampling errors can occur. Sometimes, even though it's very sensitive, it's still 91% sensitive in terms of its the Scottish measurements that we have. So it's not infallible in that sense. And then people may turn positive again if a future test is employed. And we know that one of the reasons for that happening is because these viral fragments, the RNA fragments that the virus, of almost, if you like, of dead virus, can still be picked up for some people many weeks after the initial infection. So, as I say, I can't say with any confidence at all that that's exactly what's happened with this case, because I shouldn't comment on the case. I don't know the characteristics of it. But certainly the global evidence in relation to this suggests that reinfection is not a phenomenon which we would recognise, and that all of these have tended to be testing challenges instead.
Okay, thanks, Gregor. And now Vivian Aitken from the Record.
Good afternoon, First Minister. A couple of points I'd like to ask this afternoon. Last week we spoke about the steroid drug dexamethasone, and the Chief Medical Officer was saying then that they were going to look at it in Scotland and see if it was something that we thought we would introduce up here. And I just wondered if that was actually the case, if that was actually going to be introduced up here now. And also, the Louisa Jordan, just wondered when we can start seeing patients there as a bid to get operations back up and running there.
Drug is now available to be used in the NHS, but I'll hand over to Gregor to update on that, and then I'll take the Louisa Jordan point.
So the results that relate to this trial on dexamethasone are really quite remarkable, and they offer us the first serious breakthrough in terms of offering some sort of treatment for not all patients with COVID-19, but certainly a large group of patients who require additional respiratory support, and that might be either the need for oxygen or the need for ventilation through intensive care services. And very shortly after the press conference when that was first mentioned, we started to get the first results of that filter through. The CMOs across the UK met later that afternoon to consider those results, and we agreed that they were so significant that actually this drug should be released for use immediately across the country. Now, it's a drug which we've used for many, many years in medicine. We've used it for other purposes. We've just never used it in this particular scenario. So we needed to make sure that the governance around about how we employed that drug, how we told the service that they were able to use it, and the circumstances in which they could use it were communicated effectively. And that communication was actually issued later on that day, so that on that same day, people were able to use this up and down the UK and certainly across Scotland with immediate effect.
Okay. On the second point, the Health Secretary will update on the specifics of what we will be seeking to use the Louisa Jordan for soon. That's been worked on at the moment. What I would say in general is that, well, two things. We want to keep the facility of the Louisa Jordan available to us should we need it later in the year for a resurgence of coronavirus. We've been talking today about the risks of outbreaks and localised flare-ups or imported cases. Obviously, we hope this doesn't happen, and we'll be working very hard to contain it if it does, but we also face the risk of a more general resurgence in community transmission as we go into the winter months. So we need to have that extra capacity there just in case we run into the same risks again of potential overwhelming of our National Health Service. So we want to be able to use that facility between now and then, should that happen, although we hope it doesn't, for purposes related to dealing with the elective backlog. And exactly what it would be used for and how and when is the work that's been done right now, and the Health Secretary will update on that as soon as that work has been completed. Kieran Andrews from The Times.
Thanks very much, First Minister. You said that you haven't seen the scientific advice being used by Boris Johnson and that you wouldn't necessarily expect to. Given that we're still, I think, in at least a nominal four nations approach, why is that the case, and have you or the CMO asked to see that advice?
Maybe I was being polite. I don't know. Look, I haven't seen it. Gregor may have had discussions with the CMO, who I know is one of the people, CMO in England, who's one of the people giving that advice. I hope we will see it. I had a call with the other First Ministers, with Michael Gove this morning, where in the spirit of the Four Nations, he gave us an indication of the likely direction of travel of the UK government announcements today. So I think that was useful to have. I hope we will see that advice. It's been advice that was commissioned for the UK government, and I would certainly want our advisory group to have access to that. I think we should try and, I've tried very hard, and I'll continue to try very hard to keep politics out of this, because I genuinely don't think it's got any place generally speaking, in this. I've got to take decisions that I think are right for Scotland. I've got to take those decisions based on the best evidence and applying my best judgment to them. And where it is helpful and necessary and appropriate, we try to do that on a Four Nations basis. There will inevitably be tensions in that. There have been tensions in that. There will continue to be, but we try to manage those and make sure we work as constructively as possible. And that's the approach I will continue to take. Gregor, I don't know if you have had any...
What I would say is one of the characteristics of the response to COVID-19 has been the close cooperation and the regular discussion that the clinical networks and particularly the CMOs have had. We meet on a regular basis over the course of the week. We share the evidence with each other. We discuss the evidence. Later on today, I'll be part of a Four Nations discussion which will consider a variety of different things in terms of emerging evidence and how we can use that in each of our countries. So I have absolute confidence that the advice which relates to physical distancing will be shared with us, and we'll be able to share that with our advisory group in a way that allows them to consider that alongside everything else.
And it is, as I understand it, advice that has only just been concluded and formulated and given to the UK Government. Rachel Watson from the Mail.
Thanks, First Minister. Earlier you said that you will provide more indicative dates tomorrow on when parts of the economy or lockdown can be eased. Can you tell us what evidence you've seen over the last few days that is allowing you to do that earlier than you thought? And also, just on face masks, there's still a lot of anecdotal evidence and talk of people not really wearing them in shops and when they're in shops and other places like that. Why do you think people aren't wearing them? Do you think it's because it's not mandatory, or do you think there's some other reasons behind that?
On the first point, I'll set out what I'm going to set out tomorrow, so I won't get into it in any detail today. I'll do that in Parliament tomorrow. But the evidence, what we're seeing is a continued and increasingly sustained decline in the virus, and that every day that we see the virus continue to decline and not go back the way is a day more confidence that I have that we can keep going in this direction. And this is literally a position that moves on an almost daily basis, and we just need to build confidence. But I've said all along that if the confidence grows, that we can do things, and it won't. So tomorrow, what I'm setting out will not necessarily be doing things more quickly, but it will be giving, in the main, more clarity about when we will or when we do expect to be able to do certain things for planning purposes. But I'll wait till tomorrow before saying any more about that. On face coverings, face coverings are not, as those who are wearing them right now, they're not the most comfortable things to wear. People are not particularly used to doing it, and there'll be a whole variety of reasons why people prefer not to. But the strong advice is to do so in enclosed spaces for the reasons I've already set out, so I won't repeat them. And if we don't see the voluntary use of them getting to levels that we think are necessary to get the benefit, albeit limited in the overall context benefit that we think they confer, then just as we've done in public transport, we will go down the road of making them mandatory, because we do think there is a benefit from them. But I would encourage people right now to wear them if you're going shopping, and obviously as shops open more generally from Monday, this becomes more important. Wearing one protects other people, and having other people wear them protects you. And it's just an additional thing we can do right now. Everything, as we come out of lockdown and as we start to, and some of these things have been less important, ironically, in the days over the last 3 months when this virus was much less under control, because we were all by and large staying at home, only seeing our own households. As we start to go out more, even although the virus is at lower levels, our risks are increased because we're exposed to more people. So that's when these things become more important. So even if you haven't been doing it up until now, I would urge you to do it now for the additional protection, because everything we do in this phase is about trying to mitigate and reduce the risk, because the more we do that with a collection of measures, the more chance we've got of stopping this virus going in the wrong direction again. David Ball from the Herald.
Thank you, First Minister. Just going back to the reinfection incident on Sky, is the Scottish Government aware of any other patients who have recovered who have then tested positive at all? And should people who have ensure not to be complacent in case there is evidence that does emerge that would mean that it'd still be it?
David, your line was breaking up there, so I didn't get particularly the latter part of your question, but I got the first part. I'm going to hand over to Gregor again. I'm certainly not aware of hearing of other patients who have tested positive, then negative, then positive again, but that's not to say there aren't any. Before I hand over to Gregor, if you listen to Gregor carefully later on, what he was saying, not in relation to the case on Sky, because we don't know the details and the characteristics of that, but in general terms, because somebody tests positive, again, having had the virus before, does not necessarily mean that they have been reinfected. It could be virus shedding from their first infection that has shown up again in the test. That's a very layperson's way of expressing it. You can do it much better. So
it's really important that we don't label this as a reinfection until we know more. And every case that's been looked at around the globe that I'm aware of, has certainly come down with the view that rather than reinfection, it's been a manifestation of the testing challenges that lie around about this, rather than true reinfection. I'm not aware of any other cases in Scotland where this has happened, but that doesn't mean to say that they wouldn't necessarily happen. In fact, I would almost anticipate that at some point we would get some other report like this as well, because the test is not infallible. We've said this on a number of occasions. This test is very, very good. It's very reliable, but it's not infallible. And even with perfect conditions, the sensitivity of this test still exists for maybe, 91%. And then if there's any kind of sampling errors that you bring into that, in addition to that, you can start to understand why you may get a positive test that becomes negative just through statistical chance more than anything else, and then becomes positive again. The persistence of the positivity is a feature that's recognised across the globe, and that persistence is most likely due to these viral remnants that we see remaining in people's body that the viral PCR test picks up, rather than true infection. And it's really important to make that distinction. Just because the test itself is positive, it does not mean that the person has live and viable virus on board.
Now, you had a second part of your question that I couldn't hear. If your line is better, do you want to ask it again?
Yeah, sorry about that. It was just people who have recovered from the virus. Is it wise for them to make sure they're not complacent in case they are at risk, if evidence does emerge that obviously that they could be reinfected?
It's, again, I'll hand over to Gregor, but one of the things, and you'll have heard us say this before in previous discussions about antibody testing, one of the things we simply do not know about this virus yet with any certainty is what level of immunity having it gives you, and if it does give you a level of immunity, how long that immunity lasts. So nobody who has had this virus, based on our understanding right now, can assume at all that they can't get it again. That doesn't mean we have evidence of reinfection or that this case means that somebody's been reinfected, but equally there's no certainty that that can't happen.
Again, I would say that this is an area where we're constantly going to be learning, and we've got to guard against complacency. You're absolutely right. We cannot say that having had the infection means you won't get it again. We cannot say that having the antibodies will protect you in the future from getting the infection again. We know that people develop antibodies after the infection, but the significance of that is still to be revealed through the research and the evidence that we continue to develop, not just in this country, but around the world in terms of our understanding of COVID-19. So my advice to anyone just now is that whether you've had a positive test and proven evidence of this infection or not, please don't become complacent. Please make sure that you continue to take all the precautions that you or anyone else would be expected to take to make sure that you don't expose yourself to the potential risk of infection again in the future.
Thanks, Gregor. And last question today is from Paul Mallock from the Press and Journal. Paul Mallock, are you there?
Hello, is that better? Yeah. Yes. Are you able to tell us what the Scottish Government's guidance is for families hoping to visit relatives in Northern Ireland, England and Wales? If and when they arrive, will they have to follow that nation's restrictions, or would you advise them to follow Scotland's, for example, the 2-metre social distancing rules? And would they have to quarantine on the return? And with that in mind, with lockdown restrictions likely to be loosened in the rest of the UK before they are in Scotland. Would you be discouraging family members from the other three home nations from visiting Scotland in that time?
Well, at the moment, of course, we have a 5 mile advisory limit on travel for leisure or recreation. So I wouldn't be expecting to see people from Scotland travel, to other parts of the UK on holiday, or people from other parts of the UK travel into Scotland on holiday at this moment in time. We hope we will see that lifted in the coming weeks, and we hope to see our tourist industry back up and running by the middle of July, at which point I will be, assuming all the evidence still points in this direction, I will be delighted to encourage people to have staycations in Scotland and in all the beautiful parts of our country. Issues around, obviously border issues, and I'm talking internationally here, not just within the UK, but as we go further into this, if there are differences in infection rates in different parts of the UK, even in different parts of Scotland, then in the future, of course, we may see more localised measures to try to limit transmission between different areas. But that lies ahead of us at the moment. And subject to what I've just said, obviously the 5 mile limit in Scotland doesn't apply to visiting family and friends, but we are also at this stage, apart from those in extended households, we advise you not to stay overnight in somebody's house right at this moment in time. So again, we wouldn't be advising people to travel so far that they had to have an overnight stay. But in general, so that's the rules as they are, but in general, as we move through this, my advice to anybody in any part of the UK is you follow the advice in the part of the UK you are in. In Scotland, whether you live in Scotland or are visiting Scotland, you should follow the advice of the Scottish Government. But if you're Scottish and visiting England, you should follow the advice of the UK Government for England. It's right and proper that people abide by the law in whatever country they are in, and abide by the general guidance in whatever country they are in. And I think that's a general principle overall when we're travelling either within the UK or further afield. That concludes the questions today. Can I thank Gregor, as always. Can I thank Anna, our BSL interpreter, for the day, and thank all of you for joining us. Today really is a bit of a milestone, with that 3 months since lockdown, and we look back with a lot of sadness and anguish, with a lot of personal sacrifices made along the way. But I think we can also look forward now with a much greater degree of optimism than has been the case for much of the last 3 months. We're not out of this, the virus hasn't gone away, and you will keep hearing me say that, because we must continue to be careful and cautious. But if we all keep doing the right things, then we can have greater optimism that we are on that road to recovery. So if you are interested, you can hear the Health Secretary later this afternoon in Parliament on remobilisation of the National Health Service. You can hear the Deputy First Minister on the current plans for the return of schools in August, and tomorrow I will give the daily update from the Scottish Parliament at 12:20, but First Minister's questions will also allow me to give some of the additional detail on the next steps out of lockdown that I indicated I would give earlier on. So I look forward to having you join us tomorrow, and I will see you back here in St Andrew's House at 12:30 on Thursday. But for now, thank you for joining us.